Hello and welcome to the Victory Education Lounge, your go-to resource for comprehensive, clear, and concise information on a range of complex topics. Today, we're diving into the intricate world of Alzheimer's disease, a progressive neurological disorder that happens to be the most common cause of dementia. We'll be exploring what Alzheimer's is, its causes and risk factors, and its mechanism of action. We'll also delve into how to manage this disease, its complications, and an intriguing potential link to metabolic disorders, particularly type 3 diabetes. Don't forget to like, share, and subscribe for more such informative videos. Stay healthy, stay informed. Also, sharing it with your friends, family, or anyone who might benefit from it can make a big difference. The world of Alzheimer's disease is like a vast labyrinth, filled with unknowns and complexities that researchers worldwide are striving to unravel. So, buckle up as we delve into the complex world of Alzheimer's disease. Together, we'll navigate this labyrinth, shedding light on its dark corners, and hopefully, emerging with a better understanding of this formidable adversary. Alzheimer's disease is a progressive neurological disorder that significantly impacts cognitive functions. Unraveling the mystery of Alzheimer's is like peeling back the layers of an intricate puzzle. As we delve into this complex condition, let's start by understanding what Alzheimer's disease actually is. Imagine a network. This network is not of computers or phones, but rather, it's a network of neurons or nerve cells in your brain. Alzheimer's disease is a condition where this network gradually breaks down. It's like losing connection, one neuron at a time, leading to cognitive decline over a period of time. This condition is the most common cause of dementia, a term that describes a group of symptoms affecting memory, thinking, and social abilities. Now, dementia isn't a specific disease, but it's a broad term encompassing various conditions, Alzheimer's being the most prevalent one. As we delve deeper into the symptoms of Alzheimer's, we find a pattern, a progression that is as heartbreaking as it is scientifically intriguing. The earliest signs often include difficulty remembering recent events or conversations. As the disease advances, symptoms become more severe. The person may develop language problems, disorientation, mood swings, loss of motivation, and behavioral issues. With time, the person might forget about recent experiences or events, forget the names or identities of family members, and have difficulty with language. The person may also develop changes in personality and behavior, such as increased agitation, lack of restraint, or wandering and getting lost. But remember, Alzheimer's is more than just memory loss. It's a journey of cognitive decline that can last from a few years to a decade or more, varying from person to person. The symptoms are progressive, starting with mild memory loss and escalating to severe cognitive impairment. Alzheimer's disease is a relentless adversary, one that we are still striving to fully understand and hopefully defeat one day. But as we journey through this complex maze, it's essential to remember that every person's experience with Alzheimer's is unique, and so is their strength and resilience in face of this challenge. The exact cause of Alzheimer's remains a mystery, but there are several known risk factors. Genetics plays a significant role in the development of Alzheimer's. For instance, variations in the APOE gene are linked to a higher risk of the disease. However, inheriting this gene does not mean one is destined to develop Alzheimer's. It merely increases the likelihood. In addition to genetics, lifestyle and environmental factors also contribute to the risk of Alzheimer's. Aging is the most significant risk factor. The older you are, the greater your risk. However, Alzheimer's is not a normal part of aging, and not everyone who grows old develops the disease. Family history is another key factor. Those with a parent or sibling with Alzheimer's are more likely to develop the disease themselves. The risk increases if more than one family member has the illness. Certain head injuries and some cardiovascular health factors are also associated with a higher risk of Alzheimer's. For instance, conditions that damage the heart or blood vessels, such as high blood pressure, heart disease, stroke, diabetes, or high cholesterol, can increase the risk of Alzheimer's. Lifestyle factors such as a lack of physical activity, a poor diet, social isolation, and limited mental stimulation are also believed to contribute to the risk of developing Alzheimer's. Conversely, maintaining a healthy lifestyle, regular physical activity, a balanced diet, social engagement, and mental stimulation may help lower the risk. It's important to note that having one or more of these risk factors does not mean that a person will definitely develop Alzheimer's. They merely increase the likelihood. Many people with several risk factors never develop the disease, while others with no known risk factors do. As our understanding of Alzheimer's grows, we may uncover more risk factors, and our grasp of the complex interplay between genetics, lifestyle, and environment will likely become clearer. While these risk factors increase the likelihood of developing Alzheimer's, they do not guarantee its onset. At the heart of Alzheimer's lies the accumulation of amyloid plaques and tau tangles in the brain. But what does this mean, and how does it lead to the symptoms we associate with Alzheimer's disease? Let's begin with amyloid plaques. These are sticky clusters of protein fragments that build up between the nerve cells. Think of them as roadblocks in the brain's highways, disrupting the smooth flow of communication between neurons. Next, we have tau tangles. These are twisted fibers of another protein that accumulate inside the brain's cells. Imagine them as knots in a thread, preventing essential nutrients and other critical supplies from moving along the cell's transport system. Now, these plaques and tangles don't just appear overnight, they gradually build up over time, and as they do, they trigger a series of destructive processes. They block communication between nerve cells, hinder nutrient transport, and eventually lead to the death of these cells. This cell death happens in a slow, progressive manner, starting in areas of the brain responsible for memory before spreading to other regions. When enough cells die in a particular region of the brain, the functions that region controls are compromised. This is why memory loss is often the first noticeable symptom of Alzheimer's, followed by difficulties with language, problem-solving, and other cognitive functions. But the story doesn't end here. Current research is exploring other potential mechanisms that could contribute to the onset and progression of Alzheimer's. For instance, some studies suggest that inflammation and oxidative stress might also play a role in the disease. Additionally, the brain's inability to use glucose efficiently, something that occurs in diabetes, is also being investigated as a possible factor. In essence, Alzheimer's disease is a complex and multifaceted condition. Its mechanism of action involves the interplay of several factors, each contributing to the gradual decline in cognitive function that characterizes the disease. Understanding these mechanisms is crucial to developing effective treatments and hopefully, a cure. These destructive processes lead to the characteristic symptoms of Alzheimer's. While there is currently no cure for Alzheimer's, various strategies exist to help manage its symptoms. The treatment of Alzheimer's disease is often as complex as the condition itself. The primary focus is on symptom management and improving quality of life for those affected. This is accomplished through a combination of medications, lifestyle changes, and supportive care. Medications used in Alzheimer's treatment primarily target the brain's chemistry. Cholinesterase inhibitors, for example, work by boosting levels of a chemical messenger involved in memory and judgment. Memantine, another common medication, helps slow the progression of symptoms by regulating the activity of glutamate, a different chemical messenger involved in brain functions. However, medication is just one aspect of Alzheimer's management. Lifestyle modifications also play an integral role. Regular physical activity, a balanced diet, and mental stimulation can all help slow cognitive decline. There's growing evidence that activities such as reading, playing board games, and even gardening can provide mental stimulation and help maintain cognitive function. Social engagement is another crucial aspect of managing Alzheimer's. Social isolation can exacerbate symptoms of dementia, so maintaining relationships and regular social interactions are key. Support groups can also be beneficial, providing a sense of community and understanding that can be immensely comforting to patients and caregivers alike. Supportive care, including occupational and physical therapy, can help patients maintain independence for as long as possible. Occupational therapists can suggest modifications to the home and daily routines to accommodate the patient's changing abilities. Physical therapists, on the other hand, can design exercise programs that improve strength and mobility, reducing the risk of falls and other injuries. In addition to these strategies, ongoing research is exploring new ways to treat and perhaps even prevent Alzheimer's. From innovative drug therapies to non-drug approaches like deep brain stimulation, the future holds promise for more effective Alzheimer's treatments. Though we can't yet stop Alzheimer's, we can take steps to alleviate its impact. With the right approach and a supportive team, it's possible to maintain a high quality of life while navigating the challenges of this complex disease. As Alzheimer's progresses, it brings with it a host of complications. These complications go beyond the commonly known cognitive impairments and can significantly affect an individual's day-to-day life, as well as their overall health. One of the most prevalent physical complications is difficulty with mobility. As Alzheimer's disease advances, it can disrupt the brain's communication with the muscles, leading to issues with balance, coordination, and overall motor function. This can make tasks like walking or even sitting up increasingly challenging and can greatly increase the risk of falls and related injuries. Another physical complication involves swallowing. Advanced Alzheimer's can affect the muscles and reflexes needed to swallow, a condition known as dysphagia. This can lead to choking, aspiration, or malnutrition, and may necessitate changes in diet or feeding assistance. In addition to these physical complications, Alzheimer's disease can increase susceptibility to infections, particularly pneumonia. This heightened vulnerability is due in part to difficulties with swallowing, but also to a weakened immune system response. But Alzheimer's doesn't just impact the physical. The emotional toll of this disease can be equally, if not more, challenging. People with Alzheimer's may experience feelings of frustration, confusion, anxiety, and depression. They can become withdrawn, lose interest in activities they once enjoyed, and have difficulty coping with their changing abilities. The emotional impact extends to caregivers as well. Providing care for a loved one with Alzheimer's can be incredibly stressful and emotionally draining. Caregivers often report feelings of sadness, anger, guilt, and exhaustion. It's important for caregivers to seek support through therapy, support groups, or respite care. It's crucial to understand that Alzheimer's affects more than just memory. It impacts overall quality of life. Recognizing these complications can help us better support those living with Alzheimer's and highlights the urgent need for continued research and improved treatments. Recent research suggests a potential link between Alzheimer's and metabolic disorders, particularly insulin resistance in the brain. This has led some scientists to propose a new term, type 3 diabetes. You might be wondering, what on earth is type 3 diabetes? Well, it's a concept that's still being explored, but essentially it's a term used to describe a form of Alzheimer's that appears to be driven by insulin resistance in the brain. Insulin, as you may know, is a hormone that helps regulate blood sugar levels. It's crucial for our body's energy metabolism, but insulin also plays a key role in our brains, where it helps with neuron signaling and memory formation. When insulin resistance occurs, it means that cells aren't responding to insulin as they should. In the context of Alzheimer's, the theory is that insulin resistance in the brain leads to a decrease in energy metabolism, ultimately resulting in the death of brain cells and the onset of Alzheimer's symptoms. This form of the disease is what's being referred to as type 3 diabetes. So, what does this mean for Alzheimer's treatment? If Alzheimer's is indeed a metabolic disease, then it might be possible to prevent or treat it using strategies designed to improve insulin sensitivity. For instance, lifestyle changes like a healthy diet and regular exercise, which are known to improve insulin resistance in type 2 diabetes, might also be effective for preventing or managing type 3 diabetes. Of course, it's important to note that this is still a relatively new area of research. Not all scientists agree on the validity of the type 3 diabetes concept, and more research is needed to fully understand the link between insulin resistance and Alzheimer's. But one thing is clear: this groundbreaking research could open new avenues for Alzheimer's prevention and treatment. Despite the challenges, the future holds promise for Alzheimer's research. The scientific community is tirelessly working to unravel the mysteries of this disease. Currently, researchers are studying a variety of new approaches, including immunotherapy, neuroprotective drugs, and the role of inflammation in Alzheimer's. In the realm of prevention, lifestyle modifications such as regular physical activity, a healthy diet, and mental stimulation are gaining more attention. There is also a growing interest in the potential of early detection methods like blood tests to predict Alzheimer's before symptoms appear. In terms of treatment, the focus is shifting towards developing drugs that target Alzheimer's at its roots, aiming to stop or slow the progression of the disease rather than just managing symptoms. These strategies hold the potential to transform the landscape of Alzheimer's treatment in the future. With continued research and funding, we may one day overcome Alzheimer's. Alzheimer's disease is a complex and challenging illness, but understanding it is the first step towards managing it. We've delved into the depths of this progressive neurological disorder, exploring the unknown causes, risk factors, and the intricate mechanisms at play. We've understood that it's not just about memory loss, but also about the devastating complications that can impact daily life. In our journey, we've discovered the current strategies for managing Alzheimer's, acknowledging the importance of medications, lifestyle changes, and social engagement. We've also ventured into the realm of metabolic disorders, shedding light on the intriguing concept of type 3 diabetes and its potential link to Alzheimer's. Remember, while these insights provide a general understanding, personal medical advice should always come from healthcare professionals. They can offer tailored strategies based on individual circumstances. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and leave a comment below. Together, we can raise awareness and support for Alzheimer's research.